Welcome to the Department of Surgery at the OUTU School of Community Medicine in Tulsa, Oklahoma. We're so glad you're considering our program, and we look forward to sharing some more information with you. Our mission is to produce clinically sound surgeons with a strong foundation from evidence-based learning and the ability to adapt to evolving clinical practices for proven innovations and advancements. Our residents will have a broad clinical experience and be well-versed in academic medicine. There is also a robust research experience in our training program. We are known for graduating residents who can operate with confidence and competence. Additionally, our residents will have the qualities to make them highly competitive for any surgical fellowship or be prepared for clinical general surgery in any type of practice. Currently, our program accepts 4 residents per year. A dedicated research year is possible on an individual basis after the PGY3 year. Over the past 5 years, on average, approximately half of our residents have pursued fellowships and half have entered into a community general surgery practice. Division of cases between interns and chiefs, faculty-led academic conferences including grand rounds, M&M, pre-op, acute care, and simulation conferences. Wednesdays, we have 5 hours of protected education time. Mentorship program. Residents will also have early operative experience, which means they will begin performing defined category cases during the first month of their intern year. During your time here in our Department of Surgery, your rotations will introduce you to a wide breadth of experience, including acute care, colorectal, general surgery, trauma and critical care, vascular surgery, ambulatory, pediatric, cardiothoracic, surgical oncology, bariatrics, breast surgery, private practice general surgery, burn care, transplant, and an experience at the VA Medical Center in Muskogee. Our chief residents average 1,131 cases for the past 3 years, and residents rotate between 4 different sites. Since we cannot meet in person due to the ongoing COVID-19 pandemic, we want to provide a virtual tour of the locations where our residents study, work, and practice regularly. The Schusterman campus is located in the heart of Tulsa. It is the flagship location of the OUTU School of Community Medicine. Many departments and clinics are located on this campus. The Tandy Education Center provides simulated experiences in a safe environment for learners across the OUTU School of Community Medicine's diverse programs: physician's assistant, physical therapy, occupational therapy, nursing, and social work. Additionally, the Tandy Education Center provides simulation and training services for outside agencies. Our residents visit the Tandy Education Center to do various labs throughout the year, such as vascular access lab and suture labs. We are the only testing center in Oklahoma for the Fundamentals of Laparoscopic Surgery accreditation, which is a requirement for board certification. The Learning Center is a key building on our Schusterman campus, which provides students and faculty a place to learn and study. The Learning Center contains a variety of spaces that are fully loaded with standard presentation equipment, perfect for small group studying or larger conferences and presentations. For instance, our grand rounds and conferences often take place in the Learning Center. Also on the Schusterman campus is the Schusterman Center Clinic, where the Surgery Procedure Center is located. This is where our team does outpatient procedures. We have a vascular operating room where we do hemodialysis access creation and intervention, peripheral arterial disease assessment and intervention, and venous interventions. We also have an endoscopy room where we do colonoscopies and upper GI scopes. The Burnson Building at St. John is where our surgery clinic is located. One hallway of the clinic is designated for general surgery and the other for vascular surgery. In this clinic space, we have an ultrasound exam room. We have an on-site ultrasound tech and do training and simulation sessions. Formal ultrasound testing is part of our curriculum. We also have a conference room where our vascular team hosts conferences on Wednesday mornings, and it's used for various meetings and lectures. The Kravis Building is also on the St. John campus and is home to some of our academic offices. We have 2 resident lounges, including a large resident lounge for 3rd and 4th years, and a second lounge for 1st and 2nd years. In addition, we have a game room with couches to relax between studying and cases. Designed for fifth-year chiefs, we have a specific chief's office here as well. In this office space, we also have a simulation center with both laparoscopic and endoscopic trainers. This is also where we will be testing for the fundamentals of endoscopic surgery certification, as we will be the only FES testing site in Oklahoma. In addition to our facilities and faculty, a strength of our program is the camaraderie amongst our residents and a close association between attending surgeons and residents. In tandem with a strong academic aptitude, we are seeking residents with high-quality character who work well within a team structure and who are committed to both their own education and towards improving the healthcare system as a whole for better patient care. When it comes to living in Tulsa, it's important to know that Tulsa is a wonderful place to live. Not only is Tulsa a great place to live and raise a family, it's also a vibrant community with entertainment, great food, and fun. Tulsa is the perfect sweet spot size, small enough to have an accessible cost of living, but large enough to support world-class food, arts, and outdoor parks. Tulsa has festivals, celebrations, and races throughout the year with plenty of activities to fill your weekends off. Thank you for your interest in the residency program for the Department of Surgery at the OUTU School of Community Medicine in Tulsa, Oklahoma.